am a psychiatrist, and something that I see all the time in practice is when someone gets treated for anxiety for years. I mean, maybe they're on medication, maybe they're on therapy, they're trying all the breathing exercises and nothing sticks. They still cannot focus and they still feel overwhelmed. And then one day someone says, have you ever been evaluated for ADHD? And just like that, things start to click. Or, and this happens just as often, someone gets diagnosed with ADHD. They start a stimulant medication, but their brain feels even more racy because it ends up turning out that it was anxiety the entire time. And the ADHD symptoms were just what anxiety looks like when it hijacks someone's ability to focus. So here's the thing, ADHD and anxiety can look almost identical on the surface. Both can make you feel restless, both can mess with your concentration, and both can make you feel like you're drowning in forever tasks. But they're also happening for totally different reasons in the brain, which means they need totally different approaches for treatment. And getting this whole thing wrong can really cost you years of your life. So today I'm breaking down 5 ways to really tell the difference. Not just surface level stuff, but deeper patterns that separate the two conditions, ADHD and anxiety. And if you're new here, I'm Dr. J. I'm a psychiatrist, and my goal is to make mental health make sense for you. Our first way to tell the difference, and this is huge, is to look at the timeline. You see, ADHD is what we call a neurodevelopmental condition, which means it starts in childhood, period. Now, you might not have been diagnosed in childhood, but what happens all the time, especially for women, people of color, or kids who are academically gifted and could compensate in school, is a lot of times these symptoms are missed during childhood and then they're later found out in adulthood. For example, maybe you were the kid who always forgot your homework, or you were constantly fidgeting, or you had 20 hobbies and you cycled through them every 4 months, or maybe you were considered spacey or a daydreamer. The DSM-5, which is the diagnostic manual that psychiatrists like me use, actually requires that several ADHD symptoms be present before age 12 to make a diagnosis. And not that you were diagnosed by 12, but the symptoms have to at least existed by that time. Now, anxiety on the other hand, that can genuinely start at any age. You could have been totally calm, focused kid, and then you hit college or your first job or a major stress, and just like that, anxiety shows up for the very first time. Or maybe you had some anxiety as a kid, but it goes away in your 20s and it comes back in your 30s. That's also very possible with anxiety. So here's what I ask as a psychiatrist to help clarify, or at least help me explore the differences between these two symptoms in a patient I'm seeing. I could say something like this. When you think back to elementary school, were you having trouble staying organized? Were you losing things? Were you getting in trouble for not paying attention? If the answer is yes, even if it wasn't a big problem then that may point towards ADHD. Now, if the answer is no, and they say, I was actually really focused and organized until my 20s or my 30s, then that could point towards something else, likely consistent with anxiety. Now, here's where it gets even trickier. Sometimes people with undiagnosed ADHD also develop anxiety because of the ADHD. Okay, think about this. Someone has spent their entire life feeling scattered and behind, getting negative feedback from teachers and parents and bosses, and eventually their brain learns to be anxious about everything. So they can have both, but ADHD usually comes first. Okay, second major difference, and this has to do with the actual mechanism in the brain. With ADHD, the focus problems are happening because your brain has trouble with what we call executive function. And this is basically your brain's ability to manage tasks. This could include things like starting a task, or switching between tasks, or keeping information in your working memory, and filtering out distractions. So someone with ADHD might sit down to work on something and they really want to focus, but their brain just would not lock in. They notice every single sound, every notification, every random thought in their head. And it's not that they're worried about the task, it's that their brain can't maintain attention even when there's no anxiety involved. Now here's an example. Let's say someone needs to file their taxes. They might sit down, open the tax software, and I should organize my receipts first. But where are those receipts? I need to check my email. And then they open up the email and then they see 47 unread messages and they start responding to one message, and then they completely forget about the taxes. But not because you're anxious about the taxes, it's just they're not even thinking about the taxes anymore. Now, anxiety looks different. With anxiety, the focus problem is happening because your brain is occupied by worry. You sit down to do your taxes and your brain is like, wait, what if I mess this up? What if I owe money? What if I get audited? What if? And that worry gets gets so loud that it crowds out your ability to focus on the actual task. So here's how to tell the difference. One might ask themselves, when I can focus, is it because my mind is jumping around to random, unrelated things? Or is it because I'm stuck worrying about something specific? For ADHD, you have kind of like a random mental channel surfing. While for anxiety, you're stuck in one channel, and it's the worry channel. So different brain mechanisms. The third way to tell them apart is restlessness, the type of restlessness. Because both ADHD and anxiety can make someone feel restless. But the big issue is why. With ADHD, the restlessness is pretty constant. It's not really tied to stress or a specific situation. People with ADHD often describe feeling like they have just a running motor. They fidget, they tap their feet, they need to move, and this happens when they are not stressed. Like they're watching TV and it's something they enjoy, like a cartoon or something. Zero pressure, and they're still bouncing their leg or playing with something in their hands. Some people with ADHD, especially the inattentive type, may not have physical hyperactivity, but they may have what we call a mental restlessness. Their thoughts are constantly moving. They're always thinking about the next thing, or they need constant stimulation like music or podcast or multiple tabs on your laptop, anything to keep their brain engaged. Now, anxiety-driven restlessness is different. It's tied to stress or worry. So you might feel totally calm and still when you relax, but then something stressful happens. Let's say a deadline, for example, or a difficult conversation, and suddenly you cannot sit still. Your body feels tense and your mind races. But when the stressor passes, the restlessness usually calms down as well. Okay, fourth way to tell the difference, and this is super revealing because it looks at how people respond to the structure of deadlines. People with ADHD generally struggle with too much open-ended time. Like if you tell someone with ADHD, you have 2 weeks to finish this project, work on it whenever. That's actually harder than this is due tomorrow at 5 p.m. because without that external deadline, without that structure, your brain doesn't know how to activate. So by this design, people with ADHD often work better under pressure, and that last minute panic actually helps their brain focus. It's something called hyper-focus under deadline pressure, and it may not be ideal, but it's a real pattern. For anxiety, it shows up differently with structure. People with anxiety crave structure because it reduces uncertainty. Routines feel safe. Having a clear plan reduces worry, but, and this is key, they might avoid starting tasks because they're worried about doing them wrong or not doing them perfectly. That's anxiety-driven procrastination, and it feels different than ADHD procrastination. So, what do you do with this information? Well, I want to emphasize an extremely important point, and that is, if you're worried that you struggle with anything we've talked about so far, then you might need a proper evaluation with a licensed provider who specializes in adult or child ADHD and anxiety disorders. And this is to really get a clear diagnostic and treatment picture. Because even with all of this amazing information I'm sharing with you, diagnosis is complex. There are questionnaires, there's history taking, there's ruling out conditions like sleep disorders or thyroid issues, and all these can mimic both ADHD and anxiety symptoms to add another complex layer to it. So don't try to diagnose yourself and start treatment on your own. What you can do though is understand videos like this, which will further prepare you when you or someone you love finally gets that appointment with the provider. If you found value in this video, then I think you would like this video right here, where I break down the 5 causes of anxiety symptoms that may feel and look like anxiety, but are not. The third point will really surprise you. Also, consider subscribing and leaving a comment. I read every single comment, and your insights help me figure out what to cover next. I really want to serve you. My name is Dr. J, and this has been Mental Wealth MD. Please take care of yourself, and I'll see you on the next video. Peace.